Hello, everybody. I'm Patti Patane. Intelligent conversation. This is the beginning of what could be expensive health care. I mean, this thing shows you that you've got high blood pressure, you could be in trouble. Or it could be just a normal little wellness checkup. But if you don't have insurance, this could be the beginning of something really expensive. Now, if you're at this point, do you know what this is? This is a code master. So when your heart stops beating, they put these on your chest and hit a button and they shock your heart back into beating, hopefully. And when things get to this point, hopefully you are well insured, because this is the beginning of immense cash outlay to keep you alive. We are in a clinical environment because we're talking about healthcare. First off, let me set the stage here. If you are 65 years of age or over and you are on Medicare, which you're entitled to, you do not have a single thing to worry about. Don't concern yourself with what we call, and I'm going to give you a few names here because I have Bill Robinson from Palm Canyon Insurance who's going to help me sort all of this out. So hopefully at the end of our discussion about healthcare reform law, Affordable Care Act, also known as Obamacare. They could have made it a little more difficult, but give them time. There's also something else that's very confusing. It's called exchanges. In California, it's called Covered California Marketplace. Okay. Now, I've been trying to read up on this, and I don't understand it. But Bill Robinson, I have my notes here from you. Since mid-August until around October when Obamacare goes into effect, you have participated in 45 plus hours of health insurance agent education, training, certification classes, seminars on the ACA, Affordable Care Act, and the new California Covered California Marketplaces exchanges. And so as not to get people all upset if they're on Medicare, you've also done a whole lot of education on that subject to be assured that it's not going to be affected by the Obamacare.
Yeah, that's a very important point. If you're on Medicare, what's about to take place between now and the end of the year and next year, as the Affordable Care Act fully kicks in, has no effect at all on seniors on Medicare. It had effect 2.5 years ago, all positive. It's already in effect. You have nothing more to worry about, even though I get many calls from seniors who are understandably concerned about what they hear about the Affordable Care Act coming and changes people are having to make in their plans. None of that affects seniors. Rest assured, you can just go on just fine.
So that's the definitive word. That's it. If you're on Medicare, don't worry about anything we're talking about when it comes to Obamacare. Now, in addition to the 45 hours you've already spent, you got about another 25 hours to go.
Yes.
In meetings and webinars and seminars and trying to learn how all this is going to work. Okay. Let's see if we can start from what I've gathered are some of the misunderstandings. First of all, if I have my own insurance with an employer or I am self-employed and I pay for my own health care, can I keep it?
Well, it's kind of different answers whether it's employer-sponsored coverage versus individual coverage.
Okay, let's start. If I'm employed with a company that supplies me with health care insurance and Obamacare kicks in, can I keep my current insurance?
At best, only until your employer's group plan anniversary comes around sometime during 2014. Could be as late as December or sometime during next year. When that happens, almost all employer-sponsored plans will have to be replaced by new Affordable Care Act compliant plans to satisfy the law.
So basically, what if I have an individual plan now. I'm paying it for it myself, my choice. Is my current individual, me paying health plan going to go away under Obamacare?
If you bought it before the March 23rd, 2010 date that the Affordable Care Act was signed into law, it is grandfathered. And if you haven't changed that plan since then, it's grandfathered. You can keep that plan at least for some time, theoretically indefinitely, but I think not, but for 1, 2, 3, 4 years at least. And we're just coming to learn, and that's really part of our confusion right now, that the government and the insurance companies have yet to put a lot of stuff in print that agents need to know about what are the plans and rules going to be. But they're going to narrow PPO networks as well as narrow HMO networks, which is in English taking our full PPO networks and reducing them down in size next year. All of the individual plans in the Covered California marketplace will be narrow networks, so you may not find you can go to your doctor. In the private marketplace, we're not sure, but maybe one carrier will have a full network and the others will not, and I'm very worried for my clients and sake and others that they too may not be able to keep their doctor. But if they're on a grandfathered plan, they can keep their grandfathered plan with a full network indefinitely. And another reason, if you have a grandfathered plan, you may want to keep it for a significant period of time.
If you bought your own health insurance,
Before
private health
March,
before March 2010,
right.
you'll be able to keep it for a period of time which we don't know yet.
Certainly next year and maybe a year or two following,
Okay.
probably not forever.
All right. Now,
If you didn't, then it's going to, here's the other catcher. If it's not grandfathered, and if the insurance company is participating in the Covered California marketplace, the law requires the insurance companies to cancel all those plans December 31st. Letters are going out about now to all these people telling them that their plan will be canceled at the end of December and that they'll be rolled over or mapped over to the most similar plan, according to the insurance company, of the new Affordable Care Act plans that compares to their current plan. And then if they don't like that, they can pick something else. That will happen for January 1st.
Okay.
It's unavoidable. You can't wait longer.
Okay, this is not simple. It's not. I mean, I've narrowed my questions down, and Bill has narrowed his answers down to as concise as he can possibly make it at this time. So what I'm asking you to do is, Bill's phone number is here on the screen, the name of his company, his name, so that he, in my opinion, is the best person I have found to explain this to you and to, if you wish, get you the best possible signed up deal available. But we're going to try and just give you a little comfort zone here, just enough that you can say, I think I'm probably going to need some help here, so give Bill a call, because I selected Bill to do these shows because I know he's so active in the insurance organizations and he's so up to date on everything that's happening. So this is a man you can trust. He's done the work, and he'll answer your questions, and he will get you signed up for a plan that, well, hopefully he's going to do what it needs to do. Now, is there a possibility that the Affordable Care Act, Obamacare, will not go into effect? We're not having this discussion based upon that happening. It's the law. Pure and simple. As of right now, it's the law. We're still at the end of around 2013, and it's going to be implemented in 2014. So we'll keep this program updated if anything major changes. But for right now, you better call Bill Robinson and try and figure this out. We're going to answer a few more of your questions. Okay. Even in 2014, let's say I don't want to mess with this Affordable Health Care Act. I just want to be able to say, I've got money. Okay, let's say I can afford it. So I want to come to you and I want to buy a health insurance policy that'll give me all my major coverage I need, whether it's major medical with a big deductible of $5,000 or $6,000, or whether it's a Band-Aid policy with only $500 deductible or none. Can I buy that from you in 2014? Will I have that option? Do I have that freedom?
I'm going to have to question your $500 Band-Aid policy because it sounds like a Mickey Mouse policy, but you didn't
No,
describe it that way.
By $500, I mean a $500 deductible.
No such things exist or will exist.
They don't.
Not unless you buy under the new silver plans that have limited income and they get reduced benefits because the government's going to pay part of your deductible and
No,
copayment.
the government's not going to pay part of their deductible. We are going to pay part of their deductible.
You're going to be looking at $2,000 to $5,000 deductibles.
Okay, that's under the Obamacare.
In the private marketplace or exchanges.
Any place.
One of the things, however, in Obamacare that is also certainly good, it applies to all health insurance plans that are under the new law, not grandfathered plans. Actually, even grandfathered plans have it now. Is a $6,350 maximum out-of-pocket expense for next year that will be adjusted by inflation in future years. That for the first time even includes prescription drugs. So that if you have a lot of medical bills and/or a lot of prescription bills, and you stay in network, when you've paid $6,350 out during the year, however you got there, deductible co-payments, prescriptions, the plan will pay for everything for the rest of the year. And all current plans have you paying prescription co-pays all year long. And for some patients on expensive specialty drugs or injectable drugs, they can cost thousands of dollars extra out of pocket that will go away.
But what you're saying is that somebody under this Affordable Care Act, see if I'm wrong here, would still have to come up with $6,350 before any insurance kicks in?
No. Okay. Some of the plans, a couple of plans will have a high deductible.
Okay.
Like there's a catastrophic plan for people under 30 who don't want to spend much money that doesn't pay for much, a couple of office visits and some prescriptions, and then when you get to $6,000 out of your pocket, then it pays for everything thereafter. But other plans will have a $2,000, $3,000, or $4,000 deductible. Then you'll pay 20 or 30 or 40% of the bill until collectively you get to the $6,350 figure, including the deductible. That's financial protection. As much as that money as that may sound, that's a heck of a lot better than the $10,000 or $20,000 amounts that right now today people might end up paying.
Okay. When you're talking to your clients and trying to get them to understand this, how long does it take you to have them say, "Oh, I get it"?
Well, since we can't begin to talk to our clients about these plans yet because they don't have materials, I can only speculate.
Yeah.
But it will take some time. It's not going to be particularly easy, I guess, but there will be some standardization which might make the comparisons between plans of different companies more similar. One of the things in the Affordable Care Act that's new to accommodate in our thinking is the law stipulates 4 tiers of plans. We call them metallic tiers, and they're bronze, silver, gold, and platinum. And they reflect somebody's actuarial calculations that bronze plans will pay 60% of the average medical bills a person will have, and silver is 70%, and gold 80%, and platinum 90%, and you pay the remaining balance.
Basically what it means is the more money you have to pay into your Affordable Care Plan, Obamacare insurance, the less money you're going to have to pay out for
Right.
any particular, just like anything. The more you pay up front, the less you pay when you need some kind of health insurance payment.
But I already have a unsupported by facts yet point of view that few people should spend the money for platinum plans because the premium is just going to be sky high and you're not going to get money back. I don't happen to believe the insurance companies give any free lunches.
Yeah.
And the more they charge, the more they lower their benefits that the parts that you have to pay and raise the premiums for it, they always seem to collect more money in premiums than you're lowering your out-of-pocket expenses.
Okay, now, do you have any idea at all, what a single person, no children, one individual will have to pay for, let's say, a normal little policy when they're pretty healthy? Let's go with the bronze, silver. You want to go with silver?
What age?
Oh, 30.
It's a ballpark figure.
Okay, nobody
but
knows.
I would say it could be $350.
A month?
Yes.
Before I got on Medicare, I used to pay $300 a month for my health insurance, but I had a $5,000 deductible. But you know, if I had an earache, I didn't run to the doctor. If I had a hangnail, I didn't run to the doctor. If I had a cough or a cold, I didn't run to the doctor.
A silver plan will probably have a $3,000 or $4,000 deductible.
Wow. Welcome to what appears to be reality, ladies and gentlemen.
The new plans are just not going to cost less than the old plans.
Okay. Now, let's say I have a family of 4, 2 adults and 2 children. And I need coverage. If I'm single and 30 and it's 3 or 350, maybe sort of, but I've got a family of 4 with kids, it's going to be...
I'm not going to guess at that kind of a rate, but
I've heard upwards of $1,000 a month.
the rates are going to be, the rate structure is also totally redesigned by the Affordable Care Act. One change is that there'll be a rate for every age. There's no age bracket. So age 25 is different the rate than age 26 and age 27. Husband and wife no longer enroll and get the rate for the younger of the two. They'll get the rate for each of their ages and their age brackets. Children under 20 years of age will be rated per child the same figure. More than 3 children, the rest are free.
Okay, so...
But here's the catch. If they have adult children they're covering, which has helped a lot of adult children stay on their parents' plans.
Right, there's some benefits here.
But age 20 or 21 and to 26, the rate for those adult children on the parents' plan is the same rate in addition to their other children. So now we're going to be paying a lot more money, and the kids might as well, those adult children might as well get their own coverage.
Okay.
Not going to save $1.
What it comes down to is that no matter what age I am or what family I may or may not have, and I'm looking at all this and I come and talk to you and I say, you know, I don't think I can afford any of this. I'm not going to get any of this. I don't want to participate. I don't want anything. I'm going to be irresponsible. I'm going to let the taxpayers pay if I get sick or my kids get sick or whatever.
Which is part of the problem right now.
Yes. What's the penalty if I decide to just opt out of this whole Obamacare thing?
For 2014, individual mandate says if you don't have health insurance when you file your tax return at the end of 2014, for the year you'll pay a whopping $95, the greater of $95 penalty or 1% of your adjusted gross income on the tax return you're filing. 2015 it will be 2% or $395, and 2016 it will be 2.5% or $695 per person.
Yeah, basically what you're telling me is that it's a lot less expensive for somebody struggling to pay the bills, raise a family, or just support themselves. It's a lot less expensive to say, nope, I'm done. I'm not even going to participate in this. And by the way, if I get sick, thank you very much, ladies and gentlemen, for paying your taxes and taking care of my health care, because I'm going to the emergency room and you are going to end up paying for it.
Which is one of the factors that keeps the rest of our premiums higher. But there's one other catch. You cannot, and this was discussed in a not totally joking fashion last couple of years, you cannot, without health insurance, you cannot wait till you're in the ambulance on the way to the hospital and apply for health insurance then. There are new open enrollment periods, and individuals cannot buy new health insurance anytime they want during the year. The initial rollout of the Affordable Care Act is a 6-month enrollment period, October 1st to March 31st.
So October 1st, 2013 to March 31st, 2014.
And April 1st, 2014, you cannot enroll or change your plan except for people who have special enrollment situations like losing your job and your coverage or getting married or having a child. But otherwise, you'll have to wait to the end of 2014 to enroll in plan for 2015. So you can't get insurance when you need it. You have to get it before you need it. And if you don't have the money to pay the premiums, many people saying that are in less than 400% of federal poverty level. That's an astounding level. That's $45,000 for a single person.
Wait a minute. If I'm making $45,000, I can well afford to pay my health insurance and be a responsible citizen. I don't think I should be sucking off the public and the taxpayer. That's a lot of money.
That's an honorable point of view. But if you make $44,000,
no,
you will pay here's the way it will work. Anywhere from $15,000 or $16,000 income to $45,000, you will pay a sliding scale percentage of your income as your share of the premium. It will bear no resemblance to what the real premium is. So if you were in like $35,000, you might pay 7% of your income. That's your share of the premium. All the rest of the difference between that money and the real premium of the silver plan you get to choose.
Paid for by the taxpayer.
Paid for by the taxpayers.
Hello, welcome.
Which makes it affordable for these people, many of them previously uninsured, but it's going to present an enormous burden on taxpayers. And it's also being paid for partly by the controversial tax on medical devices, and there's 3 new taxes on insurance companies and plans that are also going to be passed through to premiums to help pay for it, because it's going to cost a lot of money to pay for these subsidies.
Okay. The only thing I can recommend, his phone number's been on the screen, Palm Canyon Insurance, Bill Robinson. Please give him a call. And don't wait. Do not wait, because it's the law. And the government's going to come down on you, and you're going to think, well, no big deal. Well, from everything I've understood and everything I've researched and all my conversations with Bill, if you don't have insurance, it's going to be a big deal.
And Covered California Marketplace is the only place you can go and get the premium tax subsidy. And if you have income below 250% of poverty level, there's an also cost-sharing subsidy you'll qualify for that takes your $3,000 or $4,000 deductible and lowers it to $2,000 or $1,000 or even $500 if you really have low income. So there is, in my mind, given that that's the law and they're somehow going to come up with the money to pay for it, if you are lower to middle income and you don't have insurance and think you can afford it, you can surely afford the nominal amount you'll pay, and you should enroll in it.
Okay. Everybody's going to do the best they can to make sure that we are a nation where no one goes without health care. That's what we're trying to achieve. Whether this is the way it's going to be achieved, that remains to be seen. Call Mr. Robinson, see if he can help you out here. Okay, let's one more time on Medicare, and let's just discuss a couple of things, because I am one of those baby boomers on Medicare. And I now like what I have. Okay, I didn't like it before because I was with a different, I guess it's an HMO. We have these managed care organizations. I switched plans from paying like $40 a month to paying nothing. And it's not about the insurance company you get, it's about the managed care facility here in the Coachella Valley that you get. That's what's important, and that's what I'd like you to pay attention to. I had another one. They didn't do anything for me. I switched without knowing that I would end up with one of the managed care organizations called Desert Oasis Healthcare. I didn't think I'd like it. I've never had a nice thing to say about an HMO. I was wrong. I love Desert Oasis Healthcare. When I signed up with the new doctor and I was sent over to Desert Oasis, I was amazed. They cared about me. They want me to stay healthy. Is it in their best interest that I stay healthy? Yes. They make more money, thus they can take better care of me. Now, that's Medicare. Tell me one more time, is my Medicare insurance, health, going to be affected in any manner, shape, or form by the Affordable Care Act, Obamacare?
From this point forward, no.
No. We learned something. It's very important. Please don't get all excited about, oh, my Medicare is going. It's not. It's not going to be affected. Bill just told you.
Shine it on.
Yes, that's absolutely right. So what's the difference between my being really a happy camper with a zero pay supplement as opposed to somebody who pays for a supplement? I don't have to worry about a drug prescription plan or anything else. But
because you're on a Medicare Advantage HMO health plan that includes the Medicare prescription drug plan built into it, and currently still there are no premiums. That might change in the future because the federal government's cutting back what they're paying the HMO plans, but that hasn't happened yet. The other approach is to stay on or to go on original Medicare, as we sometimes call it, because you don't have original Medicare in force right now. You can't go to other doctors with a Medicare card and get benefits paid at all.
And I'm perfectly happy because of the choice I really accidentally made in choosing the insurance company that is contracted with Desert Oasis Healthcare. So it was a total dumb accident on my part, but I've learned an enormous amount. I really looked into it. I'm very happy. They have a wellness plan, which means keep me well. And why isn't this good for everybody?
Well, you're first of all very made the right move to change the provider and to say that the medical group that you sign up with is more important the most important factor
Yes.
than the insurance company or the stated benefits, whatever, for you to be able to get the care you want. But you still don't get to choose a specialist that is outside of Desert Oasis, but they're huge. They have all kinds
They
of
have all
specialists.
kinds. Everything I could possibly want is already on that list, and I'm very particular because I was a private pay up until the age of 65. I always had my own way and my own choices. I was spoiled.
But it's one of those issues in life that different people have different priorities and needs, and I have to respect that. I'm on original Medicare with a supplement and a separate drug plan because if I'm traveling and visiting an insurance conference in Atlanta like I was last June, if you were there, you have no benefits except life-threatening emergency benefits. If you came down with bronchitis that you were afraid could turn into pneumonia, which then a visit to the emergency room would probably be covered, otherwise isn't, you'd pay for that yourself in most cases. There is some outside care, but not much. I can go to a specialist directly without a referral in any part of the country on original Medicare. There's no network except the doctor or the provider has to take Medicare patients.
And how much are you paying every month?
I'm paying about $170, $180 a month premium for the supplement, and about $19 a month, $20 a month, let's say, for the
Okay, you're
drug plan.
$200 a month under Medicare to be able to have a whole bunch of choices, but you travel. Okay, I, for the most part, stopped traveling. Okay, I'm not interested in doing that anymore. I used to play airplane on and off a lot. I'm not going to go there unless I absolutely have to, which is maybe once or twice a year. So I just want people to know that I initially signed up because AARP said this is a good deal. Well, it wasn't a good deal for me. I found the good deal by accident. And my recommendation is that you first find out what your local HMO will offer you and what insurance company you have to sign up for to get that HMO, like Desert Oasis Healthcare. That's what you're saying is, it's not so much the insurance company you get.
It's the medical group that
the
provides
management
this.
group, which
and
is
the Medicare HMOs don't have contracts with all the medical groups. That's competition.
right.
So HealthNet doesn't have a contract with Desert Oasis. They have with another group.
Right.
And they have a better deal, I guess. But you may not have as good a set
I
of
had that
positions.
deal, and wasn't a deal. It wasn't a deal for me.
That's an important thing to watch. But there is an advantage of no premiums, very little to pay for medical care. Even hospitalization is very little. And it makes it affordable. And if you go to a place like Desert Oasis Healthcare with its multiple facilities, even geographically, they have out branches
All over the place. So there are advantages, but do your research. If you have any questions about that part of it, you call me. My name is here. The program here is on our local television. It's also on my website, and we're going to be talking about long-term health care in a program that follows. So don't wait. Please give him a call. Bill Robinson, Palm Canyon Insurance. He, in my opinion, is the best person I have found to explain this to you and to, if you wish, get you the best possible deal available.